Hello. Today I'm going to talk about breastfeeding in the era of climate change and planetary health. I will begin by introducing you to the concept of planetary health and the climate crisis, and then I will provide and share some evidence on the links between climate change and breastfeeding, and end with some actions that we can take in order to address this nexus. And I want to begin by highlighting the times where we are in right now today. Our health, the health of people, is greatly shaped by the many different changes that we are seeing around us in the global environment. In this diagram, you will see that many of our human activities or consumption patterns, the demographic shifts that we see, like population mobility, migration, rapid urbanization, among others, and technological advancement, all lead to a wide range of ecological changes, even damages, such as pollution to the air, water, and land, climate change, the loss of biodiversity, among others, as you can see in this diagram. And all of these eventually impact our health, the health of human populations. On your right, you will see the different disease areas, disease arenas that are going to be influenced by all these changes. And so this just highlights that our health and the planet's health are deeply intertwined and in fact inseparable, and therefore there is a need for a holistic and an integrated approach. And so I always remind my medical students, future health professionals, that in this day and age, we are now trying to treat not just one, but two kinds of patients. On one hand, you have this kid wearing a face mask, trying to protect herself, perhaps from the unseen coronavirus or from air pollution. And on the other hand, you have Mother Earth also wearing a face mask, of course, not to be protected from viruses, but instead to be safeguarded from the myriad ecological damages that we are inflicting on her as a result of our irresponsible human activities. And so that is what planetary health is all about. Planetary health is about taking care not just of the human patient, but also of the planetary patient, of the ecosystems on which our health greatly depends. And it really requires, again, as I've mentioned, a holistic and an integrated approach. And you may be hearing the phrase planetary health for the first time. This is not a new concept, not a novel invention. In fact, if we just go back to indigenous wisdom, we listen to indigenous communities, cultures across the world, we will realize and recognize that this idea that the health of people and the health of the planet are inextricably intertwined, interconnected, this is not a recent innovation. In fact, according to this quote from Chief Seattle, an indigenous leader of the Americas, the earth does not belong to man. Man belongs to earth. Man did not weave the web of life. He is merely a strand in it. Whatever he does to the web, he does to himself. And so, again, echoing what I mentioned earlier, we do harm to the planet, and all these harms come back to us in the form of human disease, disability, despair, if not death. And in health, in public health, in medicine, we know that there are many different ways to measure the health of people. Infant mortality rate, maternal mortality ratio, life expectancy, among others. But when it comes to the health of the planet, I want to introduce to you a way of measuring the health of the planet, the livability and survivability of planet Earth. And this is the concept or the framework of the planetary boundaries. When we say it's a boundary, it cannot be violated, cannot be breached, otherwise something wrong or bad happens. And according to the Stockholm Resilience Center, there are already 9 planetary boundaries that have been identified. And out of the 9, 6, unfortunately, have already been violated or breached, as you can see in this diagram. You will see that them in red. Unfortunately, climate change, which I'm going to elaborate on in a short while. Biosphere integrity or biodiversity over the past century, we've seen the fastest rate of extinction of creatures great and small. Land system change, we've been turning natural habitats into human settlements, golf courses, shopping malls, reclamation areas, among others, new airports, for example. Freshwater change, we've been not only over consuming the water in our lakes and rivers, we're also over contaminating them with trash, with plastic, with new chemicals, and then biogeochemical flows of phosphorus and nitrogen. We know that there are elements that are circulating in the environment, and these natural processes have already been disturbed because of our many activities. For example, our global addiction to artificial fertilizers in the name of large-scale agriculture. And the most recent planetary boundary that has already been violated is the boundary for novel entities. And when we say it's novel entities, it's pertaining to new compounds that we invent in the laboratory, we manufacture in the factory, we release to the environment. And one of the shining examples is plastic, which is now not only floating in our oceans and seas, but also, as you may have heard, microplastic has already been detected flowing in our bloodstream. So 6 out of 9 planetary boundaries. This should be a cause for alarm for all of us health professionals, because we know through a planetary health approach, what happens to the planet returns to us in the form of disease and injury and death. And, the planet's health is part of our business, of our healing mission. So I just gave you a quick intro about planetary health, the health of the planet, how it's linked to the health of people. And now I just want to focus on one of those 6 planetary boundaries that, unfortunately, as I've mentioned, has already been violated or breached, and one of which is climate change. And we know that climate change is a result of our greenhouse gas emissions. We burn fossil fuels for our energy and transport use, and also from the agricultural sector. These greenhouse gases, carbon dioxide is one of them, then led to the stabilization of the global climate system. And therefore, climate change has initiated or triggered a cascade of effects in our ecosystems, in our environment. The heating and the ocean warming and the melting of the ice caps, etc., which all then lead to these climate hazards, stronger typhoons or storms, more serious droughts, intense flooding, and more recently, as we've felt in various parts of the Philippines and Asia, heat waves or extreme heat, that all of these can lead to a wide array of health impacts operating through changes in the social and the environmental determinants of health, as you can see in the middle. And then on your right, you will see, as I already alluded to earlier, there's really no single disease group that is going to be immune to the effects of climate change. You name it, infectious diseases, whether it's the old and familiar ones like dengue and malaria, or new ones like COVID or COVID-like zoonosis, but also chronic non-communicable diseases, cardiorespiratory diseases due to air pollution, due to heat stress, among others. The nutritional status of the world is expected to be reversed if climate change is going to lead to more food insecurity, destruction of croplands. And I just want to highlight that climate change is not only a physical health issue, it's also a mental health issue. It affects the health of our brains and our hearts, whether it's through post-traumatic stress that is acquired after a storm, after being displaced by a typhoon or flooding or a flash flood, but also through a slow process. You may have heard of the new phenomenon called climate or eco-anxiety, which is now being experienced by many young people who are afraid about their future, who are not interested anymore to procreate because they're worried about the future generation. And they're also concerned about future job prospects, their survival in general. And so these are just some of the effects of climate change on human health, and basically the whole health sector is needed to really act, because every arena of health is going to be impacted. And I just want to highlight that climate change is a health issue that concerns everybody across the planet, but it is also an issue of equity and justice, because the effects are not evenly distributed across the global population. And unfortunately, there are countries that have benefited more from the climate crisis. Here you will see in this map the parts of the world that have emitted the greatest amount of greenhouse gases into the atmosphere. Those are the ones that really led to the destabilization of the global climate. North America, Europe, Russia, basically the global north, high income countries. But here you will see in this series of maps, in a paper that I co-wrote, that there are regions that are going to be bearing the brunt, that will be suffering the consequences of climate change, more disproportionate impacts. And unfortunately, these are the parts of the world that are the poorest, that have less capacity to adapt to these changes, but also who have little to do with the global climate crisis. They've emitted the least amounts of carbon, and now they are going to be impacted by climate-sensitive diseases like diarrhea, malaria, heat-related illnesses, undernutrition, which are all directly or indirectly connected also to breastfeeding. So this should really be a reason for the breastfeeding advocates to also take a look at climate change and how it connects to the breastfeeding challenge. I just want to introduce to you two terms which are going to be useful for our discussion or presentation. Mitigation and adaptation. There are two things that we need to do to address climate change. We need to mitigate. We need to reduce the emissions in the first place, the carbon emissions, the greenhouse gas emissions. And that means we need to transition fastly to low carbon pathways when it comes to energy or transport or agriculture and food consumption. But also, on the other hand, we need to adapt, because climate change is already, unfortunately, wreaking havoc in many parts of the world, including in the Philippines and Asia. We're already seeing the effects, and therefore we cannot wait for mitigation to stop or slow climate change. We must start adapting to the early effects that we are already experiencing, whether in terms of protecting our health or ensuring food security or safeguarding our built environment, our coastal communities, etc. So all these need to be done together, both mitigation and adaptation. And in the healthcare system, we need to do the same thing. We need to do mitigation. We need to embrace environmental sustainability. We want to make sure that healthcare, like the Hippocratic Oath that many of us physicians, pledged or recited, when we were entering medical practice. We said we do not want to harm our patients, do no harm. We should also do that to the planet as well. So that's sustainability. And then the other part is resilience. I mentioned adaptation. Part of it is building the resilience of the health system, making sure that the health system continues its operations, its functionality, even in the face of climate shocks and stresses. We want the health sector to be the last sector standing. We want to bend without breaking like the bamboo. That's resilience. And so we need healthcare, the health sector, the health community, to both do no harm to the planet, but also to be resilient and to be adaptive to the changes that we are seeing. And so that is the approach that we need in order to protect, our children, our infants, our neonates, against climate change and all its associated risks and threats. This is a diagram that shows to you how climate change will exacerbate many of the health issues and the social and environmental determinants of health that I referred to you a while ago, which then eventually will impact many different aspects of neonatal health, which you can see in the box at the bottom, worsening dehydration, more infectious diseases, diarrhea, poor nutrition, heat stress, among others. All of these will be, again, exacerbated or aggravated by climate change and its many different hazards and risks. And as you can see on your right, we really need to deploy a lot of interventions to protect the health of our children or infants against climate change. And you will see that many of them are familiar solutions, and we just need to do better and to scale up and to sustain the delivery of these interventions, whether it's wash or food support, nutrition support, or health education, disease control and prevention, disaster risk reduction, and emergency response, etc. But very important, and of course, this community, the listeners who are breastfeeding advocates, for sure will reinforce this and embrace this, that breastfeeding is part of the solution, and specifically early initiation of an exclusive breastfeeding. It is in itself a climate solution in order to protect our children, our babies, against the impacts of climate change, to ensure that they have a good health baseline that will protect them from, again, these emerging threats. And so it's very important that we do not stop, and instead we intensify our advocacy around breastfeeding, even in the face of climate change. And this slide summarizes many of the things that we already know in terms of the benefits of breastfeeding. It's the first vaccine because of its clear immunological role. It's good for nutrition. It protects children from non-communicable diseases like obesity and diabetes. It's beneficial for cognitive development. It even protected children and infants in particular against COVID, right? Because they're more unfortunately, there are more deaths due to lack of breastfeeding than from the disease itself, when the pandemic happened. And evidence just shows that it dramatically reduces infant mortality across the world in many different countries. So these are the benefits of breastfeeding that we need to continue telling and sharing about. But also, I think the additional benefit is that it protects children against climate change and its associated health effects. And so we need to start thinking about breastfeeding in the context of climate change. And you may be aware or familiar with this Lancet series that was published last year in 2023. Breastfeeding, crucially important, but increasingly challenged in a market-driven world. And you will see this, very well-drawn diagram that shows how we need to address the determinants of breastfeeding, from the more structural ones all the way to those that are more proximal or closer to the mother and infant dyad, and how we need to ensure that we're achieving our breastfeeding goals, from timely initiation all the way to improve maternal and child health. But what I think is missing in this Lancet paper that is published in 2023 in the era of the climate crisis, how about breastfeeding in a warmer world? So we're thinking about and we're concerned about, the market-driven world where we live in, but I think we need to start asking, how about in a warmer world, which is, by the way, connected to a market-driven world, because we know how our current economic system created the climate crisis in the first place. So everything is interconnected. But I think, an additional lens that we can add to this discourse around breastfeeding and its future is the climate lens. And in the coming slides, I'll show to you some of the different connections between breastfeeding and climate change, in addition to breastfeeding being part of the solution in itself. So one of the areas, and again, I mentioned already the importance of addressing the impacts of climate change and adapting to these impacts. And so it's important to understand how breastfeeding in itself, the practice of breastfeeding, is going to be impacted by the climate crisis. And in general, and this is an encouragement to those who are from the research community, research is still very thin when it comes to this intersection of climate and breastfeeding. But I think it's an opportunity, especially for researchers from, low and middle income countries, from places like the Philippines, to start looking at climate change and breastfeeding, how they connect, and how to ensure that breastfeeding continues even in this era of a warming planet, especially in the Philippines, which is one of the most climate vulnerable countries in the world. So in this systematic review, in terms of the impacts of hot weather on infant feeding practices in low and middle income countries, they only found 18 studies, and there's no evidence that there is a need for supplementary food or fluids even in hot weather conditions other than exclusive breastfeeding. So that's good news. Breastfeeding in itself and alone can address the needs of the infant even in a hotter weather condition. Of course, there's some evidence that in some settings, healthcare providers and relatives continue to advise water supplementation in hot weather or during the warm seasons. And so I think that's an area that requires more investigation, because what they only found is an indication. But how can we address this, under-examined, aspect, and also a practice that may increase in the future as climate change progresses. And then, of course, it's important to also understand that cultural practices, socioeconomic status, and other locally specific factors also affect infant feeding practices and may also be affected by weather and seasonal changes themselves. So, as I mentioned, climate change affects health also through indirect pathways, because they can change our behaviors, they can change our socioeconomic status, they can make us poorer in the future. And of course, the poor unfortunately will become poorer because of climate change, and that can also affect the way they do breastfeeding. And so it's important to also make sure that when we look at the connection between climate and breastfeeding, we're not looking at it in isolation, because it's also influenced by so many different factors in society and in the community. This is another paper coming from the United States, and they look at breastfeeding in the context of disasters. Earlier, we look at heat. This time, disasters, specifically hydrometeorological disasters like typhoons, cyclones. In the States, they call them hurricanes, and flooding. And these are some of the main findings. In the wake of disasters, communities lacking breastfeeding culture and local expertise and support for breastfeeding eventually depend on milk formula, and of course that will lead, unfortunately, to poor outcomes for the mother-infant dyad. And so it's very important that even before disaster happens, there is a strong breastfeeding culture, especially in highly vulnerable communities and countries. And that's very relevant for places like the Philippines, which is disaster prone. Another finding: in disaster settings, unhygienic conditions and lack of clean water make formula preparation dangerous. Access to bottles also is hard, right? Formula are also disrupted, and making therefore breastfeeding a better option. So on one hand, people are going to probably shift to milk formula in disaster settings. And therefore, we need to really intensify the promotion of breastfeeding, even in disaster settings. But on the other hand, because of these challenges, infant milk formula consumption is going to be challenging as well. And therefore, breastfeeding becomes a better option. So in either way you look at it, breastfeeding still wins, even in a disaster setting. I think we need to really try to overcome the barriers that will ensure that it's being done even in the context of disaster. And so some of the solutions that the paper is offering are investments in food security, employment, housing, flood insurance, healthcare. They can all increase breastfeeding initiation. It's very interesting, because this might be the first paper that you're seeing that part of the solution to promoting breastfeeding is flood insurance. And this is what I mean by adding a climate lens. There might be other solutions that we are not familiar with, that we have not been utilizing in our breastfeeding promotion, that we may now need to consider and incorporate in our toolbox, in our toolkit, because of climate change and how it's going to impact breastfeeding behavior. And then there's this another paper also related to higher temperatures, and some of the barriers or the challenges that they're also seeing on the ground. This one in the context of Kenya, heat injuries to neonates' skin and mouth can lead to discomfort, and therefore breastfeeding and even sleeping becomes compromised. So we also need to see how climate change affects, let's say, neonatal anatomy and physiology, in order to make sure that breastfeeding does not become an uncomfortable experience for the baby, and therefore we don't, affect breastfeeding behaviors and practices, even again in the face of extreme heat. Community members believed, according to this study, that exclusive breastfeeding is not practical in extreme heat conditions and food scarcity. So there is this growing concern that cannot be anymore ignored, because when people start saying, okay, it's very hot, or our nutritional status is very bad, and therefore we need to shift to commercial milk formula, then we need to address those drivers of unsustained breastfeeding behavior. And then extreme heat conditions also lead to longer postpartum healing period, compromised postnatal care, which then may affect breastfeeding. Let's not forget about the impact of climate change of heat on the mothers. And therefore, we need to protect our mothers so that they can continue, doing breastfeeding rather than moving to milk formula. And so, again, it requires looking at not only how climate change affects the act of breastfeeding, but also the baby and the mother, and how either their anatomy, physiology, or their behaviors and psychology may be altered or influenced by climate change, which can again then lead to effects on breastfeeding. So those are just some of the limited evidence. And again, I am encouraging our researchers, our academics, to really look into this intersection, under-examined gap. And I would say that what we need is to, quote unquote, climate-proof breastfeeding, to protect breastfeeding against climate change and its myriad effects on behavior, on the mother and the child, on society and the environment. And so these are some of the papers. This one talks about opportunities for resilience. They're talking about, more education for clinicians, especially in the context of disasters and climate change, on how to continue breastfeeding and overcome the barriers, develop care models that incorporate multiple actors, using preparedness checklists in anticipation of power outages, because we also need adequate, lighting and ventilation, which will encourage mothers to promote breastfeeding, even in disaster situations, advice on resources to plan for natural disasters, and family leave policies that prioritize the needs of women and infants. If you notice, a lot of these are familiar solutions, and we need to intensify them and to scale them up. Here's another listing from, two other references: improving guidance for healthcare workers to address heat illness in infants, training for mothers and families to manage heat, housing interventions for cooling and shading, again, because an enabling environment will encourage more breastfeeding, ensuring privacy in disaster settings as well, among others. And so, again, solutions that we know, but I think the gap is in terms of what else do we not know in terms of the how, in terms of the interventions. Again, this is a ripe arena, space for inquiry and intervention. So I talked about how climate change is going to affect breastfeeding and how we must climate-proof breastfeeding in order to ensure its sustainability even in the time of climate change. Now, the other part of the conversation or the discourse is, how about the commercial milk formula, the infant milk formula, which is the main enemy of breastfeeding. And there has been several papers, discussions published in recent years about, marketing and how this is a continuing menace in public health. But I think what we are not asking from the milk formula companies is what is their environmental impact in addition to the nutritional, the maternal neonatal health impacts that we already know about them. And that should be part of the marketing. That I think should even be part of the naming and shaming, which is counter marketing. And so if we want to highlight how the milk industry affects the environment, we need to know the evidence and the tools within our disposal. And so this one is very interesting. I want you to take a look at it. You can Google it, the Green Feeding Climate Action Tool. This is a tool developed by the Australian National University, which estimates carbon and water footprints associated with consumption of commercial milk formula among infants aged under 6 months. So, you can visit the website, but there is a paper that tried to use this tool and generated some numbers. And they use India and the global, data to estimate how much water is being consumed by the production and the consumption of commercial milk formula and the greenhouse gas emissions that are made, again, through these, practice. And you will see that, water consumption in the billions for the whole world, it's in 2 trillion. And then for greenhouse gases emissions, you will see these numbers as well. Very big numbers. And therefore, these are indications that commercial milk formula are definitely carbon intensive. And they're part of the climate crime. They're part of the exacerbation of the climate crisis. And therefore, we now have an additional reason not to promote the use of milk formula for infants. And I think it's also important to compare it with the environmental impact of breastfeeding. So here is another paper that shows to you the global warming potential of both infant formula and exclusive breastfeeding. And you will see that in terms of global warming potential, infant formula is 38% more or greater in terms of its potential to contribute to climate change. And then for terrestrial acidification, which is, when the soil becomes more acidic because of, the chemicals, for example, involved in the production of milk formula, you will see it's greater, even 72%. And eutrophication is the concentration of different elements in our water systems. You will see the numbers here as well. 35% for fresh water, greater, and 59% greater for marine or sea or ocean eutrophication. And then for land use, certainly the production of infant formula uses more land than breastfeeding. And so these are just some numbers that highlight to us that breastfeeding is a climate mitigation solution as well. It helps us lower the carbon footprint and slow and stop climate change. And you will also see that infant formula is a carbon intensive, high carbon option or intervention. And so in this very recent paper in the Bulletin of the World Health Organization, it stated that achieving global nutrition targets for breastfeeding, if we promote breastfeeding across the world, it would realize far greater reductions in greenhouse gas emissions than decarbonizing the commercial milk formula manufacturing. Why decarbonize the milk formula industry when it has little benefit to human health, to children's health, to neonatal health, when the alternative, which is breastfeeding, is not only good for health, but it's also good for the planet. We don't need to decarbonize breastfeeding. And so breastfeeding in itself is a decarbonization pathway. I think this should be told by breastfeeding advocates more and more. It's not only a nutritional, child health, maternal health intervention, it's actually a climate solution. So I'm reaching the end of my talk, and I just want to summarize some of the points that I already highlighted when it comes to the interconnections between breastfeeding and climate change. One, it's a climate adaptation measure for health in itself. It protects babies against climate-sensitive diseases, undernutrition, and many other climate-related health risks. But it needs to be climate-proof in order to adapt to climate change, because breastfeeding behaviors may change due to extreme heat or disasters, as the little evidence that we have is beginning to show to us. But it's also a climate mitigation measure as well. I've seen in the recent slides, it's much lower carbon intensive than milk formula, and we don't need to decarbonize breastfeeding. It is in itself a decarbonization pathway or intervention, and it reaps benefits not only for human health and nutrition, but also for planetary health. We need to say this more and more as we try to bring together, the breastfeeding discourse with the climate crisis challenge. And so this is the challenge which we are facing. UN says we only have 2 years remaining to save the planet. Scientists are saying we only have until 2027. We really need to act fast and to act together. And I urge and invite the breastfeeding community to be part of climate action, because we can only improve the health of people and planet through cross-sectoral action. We need to not only within our own work within our own backyard in the health sector, we need to work with the other sectors. And breastfeeding is an example of a challenge that also is shared by other sectors. It's linked to food security. It's linked to disaster risk reduction and response. It's linked to education. And therefore, we have this opportunity to improve the health of people and the planet together through cross-sectoral action. I think planetary health is about planetary humility. Planetary health invites us to shift away from this ego logical perspective. Oh, we human beings are at the top of the pyramid of nature. We can continue killing and polluting and contaminating and destroying and mining and extracting. And instead, we need to shift towards a truly ecological perspective where we human beings live in harmony with all creatures, great and small, and with all the other components of planet Earth, our one and only home. And finally, I think planetary health is about becoming a good ancestor. What we want is that in 2124, which is 100 years from now, the children of 2124 will read the history books, will look back to the past, and they will say that, the climate generation of 2024 were good ancestors to them, because we made the right decisions. We promoted breastfeeding as a climate solution. We made the right decisions not only for ourselves, but also for them as well, for those children in the future who we will never meet, but who will read the history books, the children of the future children of the Philippines and of the world who are yet to come. So together, let's advance the health of both people and the planet. Thank you very much.